what I can tell you is people have come up to me all the time and say, man, I'm sorry you lost your son. I can just imagine how tough that is. And I would say, well, if you're a parent, you can imagine it. But when it happens, it is 10 times worse than anything you can imagine. So my answer is no, you can't imagine it. Now, I've never lost a spouse or a sibling, or I'm sure that could be as bad, but gosh, losing a child, it's just something that, it's a hole in my heart that'll never be healed.
Again, my name's Keith Brown. I now work for a grant program called the High Intensity Drug Trafficking Area Program. We give money to drug task forces in North Texas and Oklahoma. We also work a lot with organizations like Miss Tenney's on prevention and treatment. Before that, I had another career with 24 years with the Drug Enforcement Administration, and got to work all over the country. I retired as a deputy assistant administrator in Washington. Washington is as messed up as you think it is. And oversaw a lot of the diversion stuff. I was also the special agent in charge over 4 states in the South at one point. So I've been around the country working with great guys like this all throughout my career. So I'm very happy to be here.
I guess I'm next. I'm Lieutenant Darren Whitman with the Allen Police Department. One of the roles that I've had the joy of doing for the last, I've been with the department for 20 years, and the last 15 as a drug recognition expert, we call it a DRE. As a DRE, we do examinations on people that have been arrested primarily for DWI, and to try and figure out the signs and symptoms that are not alcohol related. And so one of the classes of drugs, or the categories that we look at, are called narcotic analgesics. Those are the opiate drugs such as hydrocodone, morphine, heroin, and fentanyl falls in this class also. So I've taught many classes on the narcotic analgesics. So a lot of the information that I'll be able to share here later, some of it is from the classroom, some of it is from what we see out here on the streets in Allen. One of the things about Allen, a good thing is that we don't have a large drug problem here, but we do have illegal drugs and legal drugs here, prescription drugs. One of the things about fentanyl is that it's extremely powerful. And when people are taking hydrocodone and they get addicted to it, and then they go out and their prescription runs out and they go out on the street to try and find more hydrocodone, a lot of times that hydrocodone has fentanyl in it, and fentanyl is very powerful. And when they think they're taking one tablet of hydrocodone and they take that and they think it's hydrocodone and has fentanyl, then they're overdosing on us. Same thing with Xanax. Xanax is an antidepressant, and you would think that somebody who's trying to get high wouldn't be trying to take a antidepressant, but when they're putting fentanyl in it and selling it illegally, making the pills in their garage, or they're buying them from Mexico, then instead of putting actual Xanax in it, they're putting just a little bit of fentanyl, and people are overdosing from that. So a lot of the problems that we see with fentanyl are with the illegal prescription drugs, or even if there's heroin and they're cutting it or putting a little bit of fentanyl in it, and it's a little too powerful for that person, then we're getting overdoses from that. So the fentanyl is, we're starting to see it more here in Allen. We don't see it, we don't see it on every corner, but we're starting to see it more and more. We just had a DWI a couple weeks ago where the guy had fentanyl patches. A fentanyl patch is a transdermal patch that people get by prescription. people that have a terminal illness or have extreme pain, they're prescribed fentanyl. I mean, it's a drug that is prescribed and it works well for people that are trying to combat pain. And so people get those fentanyl patches illegally and then use them recreationally. And they're, this guy a couple weeks ago was driving around, under the influence of fentanyl. And he crashed and he didn't overdose and die, but we're starting to see it more and more. In 2021, we had 2 overdose deaths in Allen that were related to fentanyl. So we're starting to see it a little bit more and more.
So that leads me next. I am John Booth. I'm a police officer here in the city of Allen. Been here next month will be 9 years. The past 4 years I've been serving as a school resource officer exclusively out of Allen High School. With the amount of talent up here when it comes to fentanyl, I'll put it in high school standards. We have the varsity. I am like the freshman B team when it comes to, or C team even, when it comes to knowledge of fentanyl. And that's a good thing, okay? We haven't had any documented incidents of fentanyl being on an Allen ISD campus. My job in the school, it's really, I wear 3 hats. One, of course, is going to be a law enforcement officer, which I rarely have to do, and that's a good thing. The other 2 hats is what I wear most of the time. That's going to be partly being a informal counselor and also being an educator. So I'll go into a education mode whenever we get invited by a teacher, because sometimes teachers need a break with all that they have to deal with, so they'll invite us to come and talk in the class about a particular topic, and I'll always open it up for about 15 minutes of the last bit of the class period for kids to talk, and sometimes fentanyl comes up, or drugs, narcotics. So I'll be kind of a prevention ahead of time role in that way of teaching. So the other way is being an informal counselor. So the rules are a little bit different in the school. So we do not enforce Class C misdemeanors. That's the lowest level of charge that Texas has for criminal offenses. That's handled at the school discipline level. So I don't have a dog in that fight, really, if you will. But if in the event that we come across a student with a vape, we can that gives me an opportunity to go one-on-one with them in a setting that they're not going to get criminally in trouble. I can have that conversation about the dangers of vaping and how that liquid that's in there is unregulated and what they could be smoking could contain fentanyl and stuff like that. So it also changes with when we're talking about vape, and a problem I'm seeing in the school right now is THC. These vape pens containing THC. So the THC oils, it's a higher level of concentration than if you smoke the herbal plant. So you get a higher hit off of it, or higher effect of the marijuana. And that, because of that, makes it a felony level offense. So obviously we don't want kids having, getting felonies on their record, starting that pipeline to prison at a school level, if you will. Schools rules are a little bit different too when it comes to Class C or rather tips, anonymous tips. So if we get a tip in a school setting, I really don't have the power to go search a kid. That power lies with the principal. There's a Latin term called in loco parentis, and what that means is that you, the school administrator, they enjoy all the rights and privileges that you enjoy as a parent in a school setting. So they have the right and ability to go and search a kid just on an anonymous tip. So we do use an anonymous tip system at the high school level. It's called Tip 411. And whenever somebody sends it in, we act on it. We pass it on to an administrator, and we are present there in the event that we do uncover something that is criminal, and then that ends kind of into our ballpark, and we can take action on that. So that's really my experience with that. Again, my knowledge of fentanyl is very limited. I'm the freshman C team kind of person. This is the varsity squad. I'll pass it on.
I don't know about all that. Hi, I'm Nancy Headley. I'm an addiction counselor at Aspire in Frisco, Texas. And I'm so grateful that we're actually having these conversations right now about fentanyl, because over the last 2 months, I get a call at least once a week. Either somebody has overdosed on fentanyl or died on fentanyl. So these conversations need to be had especially with our children at home, because the fentanyl is being put into, Adderall. It's being put into Xanax, just like the officer spoke of, and you can't tell the difference between the pill that you get from your pharmacy or the pill that the cartel has brought in. I was just in South Dallas a couple of months ago with the DEA and also SAMHSA, and they are shipping the amount of pills into this area exponentially. And you were talking about, the vape pens. Even the vape pens are being, laced with the fentanyl. So I'm so passionate about this because I never thought that it would hit our community the way it is. Me, on my side, I'm seeing such an increase of my patients that are either dying or coming to me and telling me that they had, overdosed on fentanyl. I'm so grateful that there's Narcan back there because I believe every home should have the Narcan. I know that, we don't want our kids to use drugs, but you know what? They will experiment. But at least with the education that we can go home and talk to our children about what could happen and then have a life-saving device of the Narcan to be able to give to your children. If that happens, you have that in your first aid kit, just like, you'd have Band-Aids or anything else. So it's just, this is a conversation that needs to be had. It needs to be continued to have in this community, and I'm grateful to be here.
Hi, my name is Becky Tinney. I'm a licensed master level social worker in mental health and substance abuse. I'm a certified prevention specialist, and outside of my role at the council, I'm actually a practicing psychotherapist with pediatrics and adolescents. I work for Recovery Resource Council, and I'm based in Dallas, but I have a 13-year-old stepson that goes to Ford Middle School, so we spend a fair amount of time in Allen, and so, I do have some skin in this game, so to speak, from that perspective. Recovery Resource Council is a behavioral health organization. We really address all spectrums of behavioral health, not just substance misuse and addiction services. But most notably, the program that really, I think, ties me to the conversation we're having here is we've recently launched an overdose response team program that is currently serving Tarrant County and is soon to be expanding into Dallas, Denton, and Collin County as well. And that's a very grassroots, really intervention initiative that we've started. It's a partnership between our organization and local EMS services in those communities. And we are following up on individuals who have recently suffered from an overdose. So these are individuals who have survived an overdose, and we literally partner with EMS to go knock on their door and engage them in a conversation about their disease, about where they're at in that process, and just literally how we can serve them. If that conversation is strictly giving them Narcan and teaching them how to use it, then that's what we do. And if that conversation leads to something bigger, like treatment and recovery options, then our staff will be there to support them in that, potentially fund them if they need funding support in that. And we have some of our direct staff in the audience tonight, some of our certified peer specialists and our licensed social worker that goes out and on these calls with the EMS and is visiting with these individuals. And, they'll tell you that addiction has no bias. And I know we say that a lot, but truly they are out following up with these individuals everywhere from 16 to 75, from low-income neighborhoods to middle-class neighborhoods to well-off families. People that are accidentally overdosing on legitimate medications like the officers are mentioning, and people who are, caught up in a disease that maybe started with a legitimate prescription and has now turned to something illegitimate. So yeah, I think I'm just, I'm echoing what everybody says here, that it's a huge problem. The counterfeit pills and the fentanyl-laced pills is arguably one of the biggest contributors to overdose deaths that we're seeing right now in our country. And I think it's just really a lack of awareness, like everybody is saying. So, so happy to be here and just happy to be a part of this conversation. Thank you.
Well, it looks like I'm going to finish this up. I'm Michelle Niedert. I'm a licensed professional counselor. I'm the clinical director of Community Counseling Associates. I'm the previous crisis and support counselor for Allen ISD. I developed that program and passed it on. But I want to talk to you about talking to your kids. I host a podcast called Raising Mentally Healthy Kids. And I want to talk to you a little bit about why kids begin to experiment and use drugs so that you can begin to look for these things. And you may be a grandparent, an aunt, or an uncle. You may not have a small child in your home. I kind of laugh. I'm in the parenting trenches with you guys. I have an 11 and a 14-year-old, for those of you who are there. So I'm having these conversations with my kids, and everybody thinks that their child will never be approached with this. This won't happen to them. And that's one of the biggest myths, I think, even though we live in a great town and I've been a part of this community for over 2 decades, we still want to equip our kids. And so we want to talk to them, even though they're going to roll their eyes at you and go, oh my gosh, I'm not going to do that. You still want to have that conversation, because I can tell you as the crisis counselor, I have had parents bring their honor student into a program like this, and I know that child's using cocaine even though mama doesn't. And I can tell you there have been situations where I've had a mom call me and say, hey, I have heard this from another kid who's gotten mad at her's mom. You know, do you think I need to get her drug tested? And my response was always, it never hurts to check. It never hurts to verify. And I think that's just something we need to get used to having conversations with our kids about. Kids, especially in this area, become attracted to drugs sometimes because of boredom, often because of curiosity. And sometimes, and I want to make you aware of this if you're not, the SAMHSA statistics for our kids right now is 1 in 3 will have a mental health diagnosis by the time they're 18. So a lot of our kids are using some of these things that the officers are talking about to medicate emotions they can't manage. Fear and anxiety and depression. And it's so important that you're having conversations with them about that. You're checking in with them about that. Some of them are using it, and I love what Becky said at the end. I want to echo that. I want to tell a story of a friend of mine, actually, who's a national speaker, as I am, whose son, great kid, honor student, athlete, got injured in the middle of a game, started taking hydrocodone, a very typical painkiller, ran out. They're waiting on the doctor's prescription. He's at school. He's in a lot of pain. A friend shares with him a drug that friend got off the street, laced with fentanyl. My friend attended her son's funeral 2 days later from that experience. It killed him. So it's important that we're educating our kids. Somebody doesn't loan you a pill. If you don't know this as parents, please be careful. Our doctors will give us 30 of anything if we go see them, because they don't want to mess with a refill of a controlled substance. Those things, I can tell you, sometimes somebody else's kid is going to take that out of your cabinet. We have a program where we turn those in, we lock those up. It's important we're having conversations with our kids. We're letting them know, not only do we care about them, we're having a check-in at least once a week. How are you feeling? What's going on in your life? But you also watch for some of the danger signs, like all of a sudden their friend groups change. Their level of interest in their activities change. They're disconnecting from you. Yes, that's a little normal. I'm still getting used to that with my 14-year-old. But when you can't chase them down, honestly, it's time to take them on a camping trip where they can't access their screens and reconnect with them. Because you don't want to lose your kids. Because I can tell you there's probably people in here, because they're drawn to these events, who can tell you stories of, I thought we knew them. I thought we knew what was going on. And this can get out of control. I can watch a freshman trying some Adderall or some marijuana, ending up using cocaine or something harder by the junior or senior year, and then it out of control. And it being something that is destroying a family by the time they're seniors. So I just want you to be aware of this. While this is not going to happen to every family, it is going to happen to some families. And even if your child doesn't experience it, they're probably going to have a friend who does. And that's why you want to prepare them for these conversations. I know they're uncomfortable, but have them underway. I know they act like you don't matter, but the research says every time we survey your kids, you are the biggest influences on their lives.
A quick question before I pass the baton over to Diane Pfeffer. She's going to be asking the panel questions. For the benefit of our audience, where can people buy the Narcan and what's in it?
So those of y'all that don't know what Narcan is, the chemical is called naloxone. You can get it at CVS and at most pharmacies. You don't need a prescription to get it. And what Narcan does, it breaks up the chemical compounds on the receptors in the body from when the opiates are attaching. So it kind of breaks up the binding of the opiate in the body. So if somebody is overdosing on a narcotic or on an opiate like heroin or something in fentanyl, then you can administer Narcan. There's a nose spray. There's also injectable forms. So the nose spray is what we have issued at all of our officers here in Allen. So if we come across somebody who's overdosing and maybe they're still breathing a little bit, we can do a nose spray with Narcan, and it kind of just brings them right out of it. They're not very happy because we just took them out of their high and they're about to die, and they get a headache out of it, but it'll save people's lives.
Thank you. Diane?
Okay, thank you very much. All right, let's start with Keith and kind of give us a helicopter view, because we are in Texas. So tell us about, how much fentanyl is too much. It's just a tiny bit, correct? But what is that? And also maybe start first with, I think you might have said what HIDTA stands for, HIDTA, but obviously the office is in Texas because Texas must be high traffic.
Yeah, so first off with the HIDTA program, it's a grant program. It's administered by the Office of National Drug Control Policy. There's 33 of them in the United States. There's 4 of them here in Texas. The one I work for, the Texoma HIDTA, as it sounds, we cover North Texas from Tyler all the way to Amarillo, and then the state of Oklahoma. We give, it's a grant program, so we give grants to 26 different federal and state and local drug task forces and violent crime task forces, the United States Marshals Fugitive Task Forces, and then we do a lot in the prevention arena and the education arena. The big thing with HIDTA is just partnering up with anybody that's willing to work on this issue. Fentanyl. Fentanyl is measured in micrograms. The lethal dose for fentanyl is microscopic. The thing to remember with the counterfeit pills is it's being manufactured in Mexico by people who have a 5th grade education. Okay, they have a formula that they've got from China or India. They pour the chemicals together. They don't always get it right. When they stamp out the pills, they do these with industrial size tabling machines that they buy from India and China. They're not the little ones you get on Amazon. They buy the used ones that companies similar to Pfizer and Roche and people like that had. They turn these things out by the millions. They have gone to the counterfeits because, understand this about the Mexican cartels, they are capitalism unchained. If they can make money doing it, they will do it. They don't want people to die because that's killing a customer, but they really don't lose a lot of sleep over it either. So they're not measuring this stuff out precisely. They're not really caring that much. And that's how we get this. The reason they've got big into the counterfeits is, most of the heroin came out of Mexico. I've been in this game a long time. SAMHSA's statistics say that around 80% of heroin users started with a prescription drug. I've never met one that didn't. SAMHSA says they exist, but every heroin user I've ever met in the last 28 years or whatever started with a prescription drug. There are about, on an average month, according to SAMHSA's drug use surveys, there's about 400,000 people who use heroin, has used heroin in the last month. That's a big market for the cartels. In that same 30-day period, there's about 2.5 million people in the United States that have used a prescription drug against medical advice. So you're the Mexican cartels, and I've got a market here with 400,000 that I've already cornered. I already own that market. But here's a market of 2.5 million monthly users, and it's actually probably higher than that. So let's counterfeit these pills. Let's make them look exactly, as close to exactly like the real ones as we can. and we're going to make a bunch of money off of it. And the amount that kills you is so microscopic that the error of 10, 20 micrograms is more than enough to make it fatal.
Okay, Lieutenant Whitman and Booth, you've been locally here in this market. Keith sort of alluded to this, but this drug is very different than other drugs, right? And has anyone discussed the possibility of it being in marijuana?
So what we're finding and what we've learned from the DEA is that fentanyl is in every drug. Fentanyl it's a painkiller. It's a pain reliever. People get addicted to it. They have withdrawal symptoms and they build up a tolerance. But at the same time, if anybody in here has ever taken hydrocodone, it makes you drowsy, right? It sedates you. Well, we're also finding it in stimulants because it gives them a little bit of a woozy feeling, I guess, and gives them a little euphoric effect when you put a little bit of fentanyl in with the cocaine. So as far as seeing it specifically in marijuana, they're putting fentanyl in every drug. And like he was alluding to, if it's a prescription drug and it's an illegal prescription drug, it's probably going to have fentanyl in it because they can spread fentanyl out so much farther. If you buy, this much Xanax and you can get 50 pills out of it, but if you buy, this much fentanyl and you're going to spread it into your pills of Xanax, now you have, 150, 200 pills of Xanax. You're going to make a lot more money off of that. So as far as seeing it specifically in marijuana, it's in everything. So I don't know if that answers the question.
Yes, it does. Thank you. Okay, the last question is for Becky, Nancy, and Michelle. And Michelle, thank you very much for your comments about having a conversation with your child. I just wanted you to kind of weigh in on how do you start that for parents who are viewing this tape or for parents in the room. What's a good way to start? Just appreciate it.
Well, if you're not having conversations with your kids on a regular basis, you definitely don't want to start with the drug conversation, right? But, and here's what I find. A lot of parents, and this is a problem especially in this area, we want our kids to do good and look good. And so we spend a lot of times, I had a child say to me, and I'm a counselor and I'm aware of attachment parenting, who said, Mom, I don't like to come downstairs because usually when I do, you either want to talk to me about something that, a grade or something like that, or you want me to do a chore. And I kind of jokingly said, come down more often and we'll have different conversations, right? But there is a sense in which we want to have positive conversations. I'm so proud of you. These are things I see you doing well. And beyond that, even to their character, I like seeing you smile. I like the way you're a great friend. It's finding our kids' individual talents because there's more smarts than just book smarts. And so we want to point that out and celebrate that. And then we want to share with them our concerns. And a great way to do that is to ask questions. I know that I was on the Raising Mentally Healthy Kids podcast talking about how to talk to your kids about sex. And in the midst of this, one day my daughter comes downstairs and I just said, do your friends talk about sex much? And first she looks at me like, great, it's so much fun having a mom as a counselor. But there's just a sense in just simple conversations. Don't make them long. Don't make them really formal. I think there's a place when you're suspicious to, we've told our kids we own a drug test. We hope we never have to get it out and use it. But we do, and I don't expect to. I got 11 and a 14-year-old who do pretty well. But I've got it because I'm wise enough to know that it could be my child because it could be anybody's child. And having been the counselor at the high school, I just know that. I saw bright kids, struggling kids, every kid in between, band kids, football. I'm not going to pick any one thing, but nobody's exempt because you're not drug proof because you're in an activity. However, being in an activity does reduce your chances of using drugs regularly. And so we want to keep our kids active, and especially now as we've been shut down, keeping them socially engaged. And then we want to engage them with us. And I would rather have I call them flyby conversations with some questions and do more listening than talking. Well, what about fentanyl? Do you even know what that is? And if they don't, that's when you say, well, I've heard about this drug and I know probably you and your friends would never use it, but just one drop of this, if you borrow a kid's pill at school, it could take you out. And teenagers feel invincible. They feel like it's never going to be them. But we want to make that warning clear. If you need, and this is where I think the conversation is really important. If you need medicine for something, if you're struggling, if you're having panic attacks, if you can't focus in school, don't borrow a friend's pill. Let's talk about it. Let's have a counselor assess you. Let's get a doctor involved. Let's do this the right way. And I will tell you, a lot of kids who seek out medications from other people do so because their parent doesn't want to have that conversation. And I would rather you have that conversation than attend their funeral because they're using something from somebody else. So it's hard to have those conversations, but they're important.
Becky? I know you're going into homes where someone has used, overdosed. Do you also recognize, let's go into that home and see if someone else is at risk?
Yeah, so definitely part of us, we're kind of like I mentioned earlier, we're following up with anybody and everybody who's suffered an overdose. So, like I explained, that can be across the spectrum of ages and socioeconomic statuses and all those other things we look at demographically. But we know that just like substance misuse affects the entire family, engaging in a conversation about prevention and treatment and all those other things is also something that has to happen with the entire family. So when we go into a house, our goal is to not just speak to the individual that we know is suffering from the disease of addiction, but also to educate whoever else will listen to us in the realm of that person's circle. Whether it's the parents, the spouse, the roommate, the best friend. Oftentimes it's the person who called 911 when they overdosed. So that person is, equally and or maybe sometimes even more scared of what they just saw and what they witnessed than the individual who overdosed. And so, yeah, absolutely. I think, as everybody has mentioned here, I think never think that it can't happen to your family. I mean, truly, I think all of us want to think that, and all of us hope that, right? But truly never think that it can't happen to you, because the minute you put yourself in that mindset is when you're gonna start ignoring the signs. You're gonna start shutting yourself out of opportunities to have these conversations. And just through the work that we do, we encounter parents all the time who come from very good families with all of the possible resources and support and love and engagement that you could fathom, and they've lost a child. So, just like everybody is saying, never think it can't happen to you. And as far as the conversation with Narcan is concerned, it can be a controversial subject, and especially when we're talking about adults. But tonight we're talking about kids. And so when I talk about Narcan in relation to kids, for me, Narcan saves lives, period. It can't be used for anything else. It can't be misused. If you're not sure if they are using an opioid and you give it to them anyway, it's not going to harm them if they don't have an opioid in their system. And no matter how you feel about it in terms of an adult, using it on an adult maybe who's overdosed, when it comes to children, I would venture to say that you're not ever gonna come across a person who doesn't think that a child's life deserves to be saved. When we're talking about our 13, 14-year-old kids, 16, 17-year-old kids who are making a mistake that they don't know they're making. They don't understand the gravity of it. They're bored, they're partying, they want to have fun, they're experimenting. And it takes a minuscule amount for that experiment or that exploring of boredom or whatever to be fatal. And so to me, when we're talking about Narcan and having it available to use for kids, I think every child deserves the chance to be saved from a horrible mistake and to be educated or to heal if it is a mental health or behavioral situation. So yeah, that's always the conversation we're having, is engaging every person in that individual's life in the conversation. And at a bare minimum, we're having a conversation about Narcan, because I want you to live to see the day when you're ready to talk about treatment and recovery. And if that's not today, that's okay. But we want you to live to see the day when that happens.
Nance, did you want to add anything else? Or okay, Okay. All right. Well, at this point, we're going to come down or step down off the stage, and then we're going to now watch an 18-minute film, very powerful film called Fentanyl Factor. And this is provided to us by 2 counties in New Jersey, and we're so thankful for that. And so we'll be watching the film. We're not going to be taping it, and then we're going to come back and do Q&A. So I think after this 18-minute period, you'll have even more questions. Thanks so much.
Well, he had lost his brother. His brother was 12 and he was 10. And he started getting very depressed then. And obviously we were worried about, I had 4 kids, worried about the girls as well. So we took them to therapist, which really didn't do much for Jeremy. He also was a kid that was had ADHD and he was brilliant, but he had a hard time, clamping down and paying attention. Yeah. So his brother died when he was 10. And that whole next year for the rest of us was pretty miserable. When he was 13 or 14, I took him and one of his sisters to get their wisdom teeth out. And I realized this about a year ago when the Purdue Pharma, all that stuff was coming out about the drugs, that OxyContin. The oral surgeon gave Jeremy and Jenna oxycodone. And I gave it to him. I didn't know what it was. And for their pain. And Jenna didn't like it. She said it made her feel funny. And Jeremy really liked it. It made him in a good mood. I'm assuming that once Jeremy did that or had that experience, he found out that the pain of his brother, the loss of his brother, could be secured. And then it was 14 till 31. He was on a roller coaster. And this is what his life was reduced to. He was responsible enough to put him in something so nobody else was going to get stuck by a needle. But this was his life. So I think I was going to get rid of them. There's some other paraphernalia in there too. I was going to get rid of them, but I saved them for my grandchildren. Because this looks miserable. This looks horrible. This looks like something you'd find in a homeless shelter, or not even a shelter, outside somewhere. And this was in my house, in the room he had where he was staying, trying to get back on his feet. I didn't know it was still going on to this extent. But, yeah.
He said something that ended up being helpful, actually. My wife put a hold on his banking account because he was taking all of his money and buying the next whatever he was taking. And when he found out, he got mad, and I called 911. It's the hardest thing I've ever done. The police came. They talked to Kellis, talked to me, talked to my wife, and Kellis goes, "Mom, you put my money back in my account. You put my money in my account or I'm going to kill myself." And I just couldn't believe I heard that. But they put him in the police car, closed the door, and the policeman said, "He's not going to kill himself. We see this all the time. He's just saying that." However, the fact that he did say it means we can lock him up for 72 hours. So they took him to a psych ward and kind of helped detox him, but he was in a safe place. And 72 hours later, we had a family meeting, and his sister Maggie said, "I'll take him." She's 26, and she goes, "He don't want to live with mom and dad. He's not going to live anywhere else. Let him come live with me." It was so amazing to have him back, because he had, through this process, he'd kind of overcome the day-to-day drug dependency he had. He got back his dignity, his humanity, his personality, and it was some of the best days of my life. Because we thought we had lost him. So we really enjoyed each other. The best part of him was coming out, and he was continuing to do everything he needed to do to move ahead. But like I told my best friend, I go, he's really making a lot of progress, but it is one day at a time. Because what he was messed up with, opioids, the next mistake is your last mistake. Thought we were over the edge. Thought we'd made it. But on day 95, it caught him. And if I'm talking too much, but if I could say anything to anybody out there, it's how wicked fentanyl is. How nowadays, I think, most people who take it don't realize they're taking it. It's being laced into all kinds of other things. And so, your 4 high school kids sitting around smoking a joint, they all wake up dead. They didn't see it coming. And that is where we all need to be more vigilant.
While they're coming up, I'm going to ask the first question. I drive slower than a turtle now, but when I was 16 and 17, look out. Now, looking back, I had the same philosophy. I could drive 60 around a curve, a residential curve, and nothing would go wrong because it's not going to happen to me. Okay, I'm sure all of you on this panel have heard that. How would y'all address that issue?
I'll start. I'll start. I'll keep it fairly simple. Becky, she and I have talked about stuff like this. Kids think they're invincible. Parents think their kids are great. The one advice I give to all parents as it relates to their children in this issue, do not believe your kids. They will lie to you. They will lie to you about doing their homework. They're going to lie to you about this. Trust your instincts. I've talked to lots of parents who've lost kids, and most of them will tell you, when they're being honest, they saw it. They felt it. They didn't want to believe it. Believe it, and don't believe them. They will lie to you about this. Look for the things that are odd. Something that caught me in this video. A couple of them were like, they were at the hotel. If your kid's living in a hotel, okay, there's probably something going on in their lives. So just don't believe them and trust your instincts. You know your kids. You know when things are different. Believe in it. And again, I've been a cop all my adult life. It's all I know. Narcan works. Get it. It has an expiration date. Ignore that. If it's expired, it won't kill you. Give it to them anyway. Okay? Get it. Keep it. Don't believe your kids.
So I have one thing to add to that when you're talking about, when you're saying don't trust your children. But an example of that is just 2 weeks ago, one of our SROs at the Lowry Freshman Center arrested a student there. He's 15 years old. He had some vaping liquid that had THC in it. He also had some Xanax on him. And we started talking to him about it, and I asked him, I said, well, where did you get the Xanax? And he said, well, off Instagram. So he searched on Instagram, found Xanax, and the guy met him down at the corner of his street, I said, well, how'd you end up going to buy this? You're 15. He said, well, I just walked down to the corner of my street, gave the guy $50, and he gave me the Xanax. And so it was that easy. So it's out there. So like they were all saying, talk to your children, talk to them about the dangers of getting things illegally off the street of people that he didn't even know this person. And in the high schools and in the other schools, they're trading, they'll trade drugs. You never know where they're getting it from.
I would add to that, know where your kids are, know who they're with. I turned my kids' cash into a cash card because drug dealers don't take those. So that's what he talked about. We don't want them to have access to available cash. That's another thing to look at. If you've got a kid who's in college right now, this is an important conversation to have with young adults. They're at even higher risk because they're kind of in that spot where they're not with you anymore. But it's important to have the conversation. And what I tell parents, because we have dealt with this in our center over and over again, the devastating effects of this, is don't tell your kids they're going to die. Tell them how much you'll miss them if they do. Because that's what gets to your kids. Tell them how much you care about them and how devastated you would be if they weren't with you. And does that make sense? They're going to argue with you about whether or not they're going to die, but they're going to have a hard time arguing with you about how much you're going to miss them if they're gone.
Absolutely. Sorry, I'm going to switch hands. The Narcan that they are all speaking of, we have partnered with Brazos Treatment Center. I represent Stonegate Center here in Azle, Texas. It is a treatment center here. But I'm also super passionate about this, and I make sure that every single person I come in contact has a Narcan kit. So we've partnered with them today to provide each and every one of you all a Narcan kit, as well as if you go to morenarcanplease.com, you can get them shipped directly to you. But on one note, I just want to point out is that these don't expire. He mentioned it. I'm going to mention it again. Keep them. Keep them everywhere you go. Keep one in your car. Keep one in your cabinet. Give them away as gifts. I gave everyone in my family Christmas gifts this year, and we do Dirty Santa, and this was in every single one of them. And I had the opportunity to explain to them what it was and how to use it. If you don't know what it is, or if you don't know how to use it, it is very simple. Just pump up the nose. If you are not experiencing an overdose, it has zero effect. If you are, it reverses it. And so this is a life-saving device that is free. I'm not sure here in the state of Texas. I'm from Oklahoma. Woohoo, Boomer Sooner. Sorry, I had to take the opportunity to say that. Sorry. But no, in Oklahoma, you can text a number and get it directly to you. There's a website on these boxes that you can get it shipped directly to you. Get as many as you want. They are free. I do believe at Walgreens and CVS, you do have to pay $35, last I was told. And don't pay for them. They're free. We have a lot of treatment facilities in here, sober living homes, a detox unit represented, churches. Keep these at church. Keep them everywhere you go. Leave them in a bathroom. It doesn't matter. People aren't going to ask you for these. Make them available for everybody. So that's why I'm here tonight, is to provide the Narcan kit. So.
Kiara, you might want to talk about the prevalence of fentanyl in Oklahoma. It's just up the road.
Absolutely. So I've been doing these documentary series with Diane and Eric, and I also do a lot of fentanyl trainings in schools and churches in the state of Oklahoma. And I personally, I'm going to tear up when I say this, have lost 32 since the last week of October. So that's how passionate I am about it. I help families get into treatment every single day. And just within the last 2 weeks, out of the 4, 2 died. That's the impact it's having in Oklahoma. They were ready. They were willing to go to treatment. That one last use, they're gone. I've attended 17 funerals in 33 days. So if you can put that math to work, that's how prevalent it is in Oklahoma. It is the leading cause of death, ages 18 to 45. In the United States. I can throw a lot of statistics out there for you, but I want to leave this one main statistic. We wake up every single morning and we get COVID numbers every single day thrown in our face. Statistics, who's dying, who's testing positive, those sort of things, but no one's talking about fentanyl. Nobody. not one single person, but it is the leading cause of death and overdose in the state of Oklahoma. And I'm sure in many other states, including the United States, it is killing more people than COVID, car wrecks, suicide, and there was one other one that I just completely forgot. But all of those, cancer, all of those combined. And when you throw out the cancer word, people cringe. Fentanyl is killing more than that on a daily basis. And like this video showed, just in the 18 minutes that we watched that video, one person has died. That's the impact it's having.
Yeah, just to add color to that statistic, as I was driving up here, I asked Siri what the population of Allen is. It's 104,000 people. In the last year, that same number of people, a little short of that, about 101,000 people in the United States have died of a drug overdose. Imagine every man, woman, and child in Allen gone. That's the extent of this. 100,000 people is an incredible number, and that's every year. And so, in 2001, we went to war over a terrorist attack that killed 3,000 Americans, and we should have. Fentanyl kills 3,000 people a month. So just to give you a perspective on the damage.
Very powerful, and putting it in perspective. Thank you. What questions do you have? Yes.
I don't understand why they add the fentanyl. I mean, I know you said, why would you kill off your customer base? But is it that? I mean, if you only can put micrograms in there, I mean, is it like this much Xanax, this much baby powder, and this much fentanyl? I mean, okay.
You stretch out the drugs, so there's more money.
But so, because you want them to feel something? Because if there's not enough Xanax and there's too much baby powder and there's no fentanyl, then why are they going to keep doing Xanax? Because they're not ever feeling anything?
Well, I mean, it's like anything else. They're seeking the effect, okay? And the effect's what's important. Why the Mexican cartels picked fentanyl? Heroin, cocaine, marijuana is a crop, okay? You've got to grow it. It can be eradicated. It can die. It's expensive. The turnaround time on it, you've got to grow a marijuana plant just like, you grow corn. You got to grow a marijuana plant. You've got to grow a poppy plant. You've got to grow a coca plant in South America. That's time. Time is money. It's a capitalist business just like any other. Fentanyl is a compound. It's a chemical. Mix chemicals together in the right proportions, at the right temperatures, under the right pressure, you have fentanyl. The turnover on fentanyl is incredibly high. Again, you think about it in terms of capitalism and markets and things like that. You want something that you only need a little bit of, because now instead of, if it was hydrocodone, I could make 1,000 with fentanyl, with the exact same amount of fentanyl, I could make 100,000. And
But
I'm going to sell them for that
If they're killing 100,000
price.
people a year, they're going to kill off all their clients at some point.
Well, they haven't yet.
Yeah.
So they just, it's a business that keeps producing more clients, unfortunately. The problem is society wants to break this down into evil drug dealers and people who use drugs. Okay? People who have a substance abuse disorder. It's just really not that simple. Most people who at a lower level sell drugs to support their own addiction. So it's the problem you see with a lot of time with drugs in the United States is we want to oversimplify it. The evil Mexicans and the kids here in America who have substance abuse disorder, and unfortunately some of them die, it's way more complicated than that. It's as opposed to any other disease, and substance abuse disorder is a disease, 100% is, but there are people who have that disease that are willingly spreading it to other people. And it makes it a kind of a different thing.
I just can't tell you how many kids I had a conversation in the high school about. They did not realize that really and truly they were a drug dealer. If they went and drove somewhere, picked up the drugs, paid for it, and instead of dividing it by 5, divided it by 4, so they didn't have to pay for it, They do not see themselves as a drug dealer by doing that. They see themselves as a friend.
Yes. Thank you. Oh, you can use mine. Yeah.
How y'all doing tonight? I appreciate y'all coming out and explaining to us all about fentanyl and the opioid crisis. Quick question though, how much to blame should we place on the pharmaceutical companies in terms of the opioid crisis? Because I know, like you said, every single heroin addict that or 85% was, connected to either some pills or things that they got from over the cabinet. Maybe they got out of their drug cabinet from their parents. So it sounds like the buck starts at the pharmaceutical companies. What did y'all have to say about that? What's your opinion on that?
I'll go first because for the last 3 years of my career, I oversaw the pharmaceutical companies in the United States from a DEA standpoint. They're about making money, okay? They always have been. They're for-profit businesses. You go back and look through. They're settling lawsuits left and right through all the states. That Oklahoma's suing them. They're being sued in Texas. They've settled throughout the United States because I don't think, as opposed to the Mexican traffickers, I don't think they created this knowing what it would do. But they didn't take the steps when they could have and when they should have to do it. And it's not just the pharmaceutical companies, it's the entire chain. Pharmaceutical companies to distributors to pharmacists to doctors who, there's DEA talks a lot about the bad doctors, the pill mills. They exist and they're drug dealers. But there are a lot of other doctors who just sort of go to sleep at the wheel and sort of give people what they want. They let the patients medicate themselves. They let the patients get what they want. So you want to talk about a complete failure of a system. It was a complete failure of a system. And it cost a lot of lives. Fortunately, we're starting to turn that corner on the legitimate pharmaceuticals. Still a problem, still exists, still overprescribing, but we are getting better about that. And in 2017 or 18, for the first time in years, the drug overdose numbers finally started to come down because we reduced prescriptions in the United States, particularly of opioids, and in comes fentanyl, and changed everything. But yes, the drug companies, the medical community, the United States government, I worked for them, we all let you all down.
I think too, just to add to what Keith said, I think on that note of kind of Keith saying that it's a failure of a system and it's a trickle down effect, right? So the pharmaceutical companies are educating these doctors. They're not giving them all of the correct information. They're not doing their due diligence to really explain to these doctors all of the risk factors maybe associated, especially early on in the opioid epidemic, right? We've come a long way. But two, I think as people, as everyday people, right, we kind of grow up with this, like there's certain pillars of our community that we are just kind of groomed to trust blindly. And doctors, our medical professionals are one of those people. And this is not me telling you not to trust your doctor, but what I'm saying is, like, when we come in just from a standpoint of naivety and really understanding what we're being prescribed or the risks that come in with using these strong pain medications, the doctor is doing what they do and trying to keep us out of pain and trying to help us heal and doing what they do. And we are just like following with a blind faith and not asking questions, right? And what are we always told when you go to get a prescription from the doctor? Finish your prescription. Like, no matter what it is, right? It's like, finish this. And that same kind of mentality that's like really great when you're talking about antibiotics can become really dangerous when you're talking about Vicodin or, hydrocodone for a tooth extraction or an injury from work. But we do that because we're trying to just do what we're told. And it's, I don't think it's malice necessarily always on the doctor's part. They're just doing what they've been told is like what they need to recommend to you. So I think, that's a part of it too. When we're talking about education, I think that's a big part of it. It's not just education, but it's empowering people to advocate for themselves in those situations and letting them know, It's okay to ask your doctor questions. It's okay to ask them if it's safe. It's okay to ask them, do I really need 30 of these, or can I just take 15, right? Like it's okay to have those conversations, and we should have those conversations. And so I think that's another part of it too, is like I said, we just kind of lead with this blind loyalty. And we don't have to do that. You know, it's okay. It's okay to challenge that. It's okay to engage in that conversation.
Is it a good idea to educate our kids about Narcan and give them Narcan to take with them when they go to a party or go out with friends?
100% yes. Yeah.
I want to touch base on that really quickly. So we're putting a face to fentanyl. I can tell just by sitting back and listening, everyone is putting a face to fentanyl. They think it's the addict, the person under the bridge, the person who's suffered, the ones that are in recovery, that are having a relapse. This is Russian roulette that these people are playing. And it's not just addicts, those who are struggling with substance abuse, those who might be in recovery and have a relapse of some sort. These are kids. Raise your hand in the room if you are a parent. Okay. These are kids that are going to that Friday night party. These are kids that are going to that high school get together. These are kids in their freshman year of college that are like, I'm at a party, let's smoke a joint. Or, hey, this is an Adderall pill. You're going to stay up all night and get all of your homework done in one day. You know, those sort of things. These are kids that have never tried things, and this might be their only try, and then they're gone. And so I don't want to put a face to who Narcan is for. I don't want to put a face to what fentanyl is. I want to prepare and be a resource for anyone who might be approached. Peer pressure is huge. I know you can talk a little bit more about peer pressure, but I've been a student in college. I've been an addict, or a child of an addict, and if I would have had Narcan in my house, I would have saved many, many, many lives. And it is not the person that you think it is, ever. It is someone going to that party, that freshman year. I will tell you a little story about what's happening in Edmond, Oklahoma. There was a high school party going on 3 months now. A mom had 10 kids out in her garage, and they were just having a small little minor birthday party. And parents were already upset because of COVID, but they had that party. And she woke up that next morning to 3 people dead in her living room. Unacceptable. Had no clue about fentanyl, had no clue. They got it off of Instagram, and it was delivered to their front door, right in front of their parents. So that's the people that need Narcan.
Any other questions of the audience? Come on down.
While she's walking down, one thing that's been a game changer in fentanyl, you've heard a lot of talk about Xanax. Xanax, it's almost impossible to kill yourself with real Xanax. It's just not, it's the pharmacology is not there to overdose on real Xanax. Kids know that. Google will tell them that. Xanax is also very prevalent in medicine cabinets. They've seen their moms and dads take it and their grandmothers take it. My mom took it all of her life. She was addicted to it, but it wasn't fatal. So there's I was talking to the officers here about there is Xanax in Allen. All it takes to have 2 deaths become 20 is those real Xanaxes. All of a sudden, you saw the picture of them, they look just like the real Xanax. Now they have fentanyl, and now that 2 overdoses in a matter of days, I've seen it happen all over the country, that 2 overdoses becomes 20 in a weekend. So the Xanax, there's game changers in this situation. The putting of it in Xanax is a game changer.
I think that, I was just going to say, there are parties where kids each bring a couple pills, throw them in a jar, and then they grab some. And they don't know what they're getting. And that's got to stop even more than ever with fentanyl. And I'm not talking, I think sometimes when you think about this, you think of college kids. But I want you to know this happens in middle schools in our county. This happens in the high school age. Some of those prescription kills, the kids think they're safe because they think somebody got them from a doctor and from a pharmacy, and we don't know that.
So I just like to add about the Narcan comment. I think it saves lives. I've been to houses where, the police usually beat the fire department there because we're out patrolling. And when we get to an overdose and it's a party, and I've been to parties where somebody overdoses and I don't have Xanax or a Narcan in my pocket. We weren't issued it yet, and we're waiting on the fire department to get there. But if any one of those kids had it in their car or it's in the house, then we could have brought the person right out because it brings them right out.
Question, we've got an election coming up pretty soon. I want to know how is it for the state of Texas? Obviously, this is getting through Mexico. It's coming in through Mexico. What are our leaders doing to assist and help you to stop that coming in, the fentanyl? What are they doing? Because we do have an election coming up, so we can address that and get proactive. We need to get that stopped. I mean, we need to stop the entrance. I'm assuming it's coming in from Mexico.
Yes, ma'am, it is. The short answer to your question, and I'm retired from the federal government, so I can say this out loud, and I mean this in a bipartisan sense, the answer to that is not enough, okay? They're not doing enough. There has to be a national will to take on fentanyl. Becky and I've talked about this. If you ever hear someone say, law enforcement is the answer, if you ever hear a treatment professional say, well, we're the answer. You ever hear an education professional say, well, we're the answer? No, we're all part of the answer, okay? But fentanyl, the manufacture of it doesn't happen in the United States. The chemicals don't come from the United States. The tabling machines that produce it into the counterfeit pills come from Asia. The chemicals come from Asia. They go to Mexico. There has to be a national will to say, we're the United States of America, China and India, you got to quit sending these chemicals to Mexico. You're killing our folks. Mexico, you got to get serious about this. I mean, again, I go back to the 9/11 comment. Al-Qaeda killed 3,000 Americans, and we spent the next 15 years eradicating them from the face of the earth, okay? The Mexican cartels, we wage a law enforcement struggle against them, but they're in another country, and another country that, frankly, doesn't do near enough to help us out with that problem. So, I think it's a fair question to ask people running for office at any level. What are you going to do about fentanyl?
I'm talking about just here in Texas too. Let's just think about us for now, and then because the other states are looking to Texas. Texas is kind of leading in different areas.
And look, I'm not a native Texan. I married one.
That's okay. You're forgiven.
Thank you. God bless Texas. Look, I spend a lot of time with people at DPS, Texas Department of Public Safety. They're doing everything they can. But there is again, it's not. Yes, it's the Texas border. Actually, most of the counterfeit drugs, way more of the counterfeit drugs, cross the Arizona border. It's a cartel reason and a manufacturing reason. There's a lot of reasons for it. But most of the counterfeit drugs, particularly in Oklahoma, come from Arizona, okay? So it is an all of our problem. And it is a national problem. There's very little that your state representative in Texas can do to influence China, India, and the Republic of Mexico. It is really more of a federal problem. These guys, what you want to do is you want to elect people that not only support these two gentlemen, but support her and her and her and her.
Absolutely.
Okay. So,
Absolutely.
So if a politician stands up there and goes, well, law enforcement's the answer, that's what we need, and he doesn't talk about recovery, he doesn't talk about treatment, he don't talk about prevention, elect somebody else.
Right. Okay.
We have somebody else here ready for a question.
Hi there. This isn't actually a question. I just wanted to thank you guys so much for being here tonight and sharing your knowledge. I did want to add one thing that did come up during listening to you guys talk. So I actually am the LMSW that is on the overdose response team with Becky. And we have been seeing out in the field that it's actually taking typically at least 2 doses of Narcan versus just 1, because the fentanyl is so strong and is not the micro that, you would normally think that it is. It's just getting worse. So that's just something to keep in mind, because just having one box is not enough. So I just wanted to share that with you guys.
Thank you for sharing. That's a good piece of information.
Yeah, and to Sage's point, you can continue administering Narcan until first responders get there. You can't overdose a person on Narcan. It's not going to hurt them. So if you give one dose and it doesn't work, give another and another and another until EMS is there and can do something different. So yeah, I think that's a great point to make, that one is certainly not enough, two at a minimum.
And each kit has 2 in there, so.
I do a lot of education to schools, drug education to schools, and fentanyl is part of that
Thank you.
education. You're welcome. What's interesting is you're saying have conversations with your kids. You have no idea how many kids need Narcan for their parents. So we have to have these conversations. It is moms and dads and aunts and uncles and brothers and sisters. It is our families. We have to have these conversations. Everybody has to have Narcan. Thanks.
Thank you.
Thank you for doing what you do.
I have a comment as a parent, and it comes with a question. So I'm a parent who has a 20-year-old that when he was 14 to 15 thought, what's the problem with marijuana? He one night ordered it off of, I think it was an Instagram, it was the one that disappears, Snapchat. He ordered it, and only because I have rules with my kids, I can check their phones at any time. Something seemed off. Did I check it? Snapchat actually deleted it, but he didn't know that, so he fessed up that night they had ordered it, just somebody on Snapchat had it come to the house, my son's friend's house, walked outside, gave somebody money, went back inside the friend's house. And he was just telling me more and more, I want to just watch TV with this friend. So anyway, my comment as a parent is I started doing random drug tests, and it is one of my big things that I tell people. I tell my own kids, I have a 12-year-old right now and a 17-year-old, and I tell them, just tell your friends right up front, I do random drug tests. Marijuana is $1 a test at Dollar Tree. Now it's $1.25. And drug test that's just a panel is like $1 a piece if you buy it on Amazon. And when my kid got sneaky and started getting urine other places and stuff, then I would wait till we were out somewhere and do it. Like we'd stop by the chiropractor and I'd say, okay, I want you to go in right now. They didn't have their backpack with them. They didn't have anything. Those are my comments. Here's my question. I have a that same 20-year-old son, doesn't want to do marijuana now at all, has had some bad experiences, is totally scared of drugs. From word of mouth, I know that he has roommates that do them, that have dropped acid, that do weed all the time. Who knows where they're getting it from? As a parent, but not of those children, do I have any, like I was thinking tonight, the most I could do is ask my son to watch this and share it with his friend. Like I have removed, and one of the roommates went home and totally flipped. Like he's been doing acid and marijuana, and he started, none of his texts make sense. He paces around the house. He's gone home to live with his parents. He's not at the so even when they don't die, my question is, what can I do as a parent when it's not my own kid? And I have big conversations with my own kids.
I want the police officers to answer this.
So that's a good question. Thank you for asking that and bringing that up. So part of my job, and I don't want to give too much of my technique in the school, but I have a social media accounts rather, plural. That way I cover all my bases, like the Snapchat, the Instagram, the TikTok's real popular now with the kids doing the dances and stuff. I pose as a 16-year-old stud, really, and much better looking than I was in high school. So, but and every time I've sent a follow request to somebody, I have yet to be denied. And so that's whenever I talk to parents, they ask me about social media, which one's the key. Seems like the worst one is Snapchat. That seems to be the devil, if you will. But it really happens on all platforms. And unfortunately, the reason that there's so many is because once law enforcement gets gauged in on one, another one pops up. And there's stuff that they're unique in how they communicate, and they use things that disappear right away, or they delete their phone. But there is resources out there that parents can have and reach out to. If your parents in the room, reach out to your schools and the counselors and even the SROs, and you can get resources to monitor your kids' phones and what they're doing.
How can a parent here contact the police without causing? This is the biggest question I have. I mean, that people tell me, but I don't want to get people arrested. How can they talk to somebody in a non-combative sense to the police department?
Well, so we have an anonymous text line that you can text in. You can text in tips. You can say, "Hey, I want an officer to call me." Anything like that. Obviously we work 24/7, so there's always somebody around that can give advice. But you can send something to the anonymous and say, "Hey, I would like an officer to call me at this time and talk to me about drugs or whatever is on your mind." And to answer your question about your child's friends or your son's friends, peer pressure is very powerful. And if he's around it all the time, it's just going to take maybe one time where he says, "Well, okay, I'll go ahead and take that just this once, just to get him off their back." You can talk to him about that, but it's peer pressure is very difficult to deal with. But the other thing too, if he's driving his friends around and they have drugs with them, and he gets pulled over for running a stop sign, and we search that car, and his friend sticks it underneath the seat, well, now we're going to arrest your son because it's his car, it's underneath his seat or within his range, and his friends are like, "No, it's not ours." We're going to put him in jail, and we're probably going to seize his car and do everything that comes along with an arrest, for a drug arrest. So he's, you can talk to him about those kinds of things. He's putting himself in a bad position just being around it.
We absolutely have had conversations about that multiple times, also about alcohol, and I keep trying to have the conversations.
One of the therapists, would you like to address that?
I would just say don't give up on the conversations. Even though they're going to dismiss you, they still heard you. Keep them short, keep them sweet, no sermons needed. The other thing I would say that I really encourage parents to do when I worked at the high school is let the SRO, you don't have to tell the SROs everything, but you can tell them, "Hey, you might want to go check out these apartments sometime, or you might want to go hang out at this restaurant." Those kind of things are really helpful to these guys. It helps them kind of know where stuff is coming from and coming into. Kids have money in Allen. As long as we have money in Allen, then people are going to want to market to us.
And there is a market to that. The Tip 411 program, I've handed out probably at least $1,000. It's funded by Crime Stoppers. So the same one, if there's a loose murderer out on the street, that number you call for Crime Stoppers, it's the same funding for it. So if your tip that you supply us ends up resulting in getting drugs off out of the school, we pay them in Amazon gift cards, which we all know is just as good as cash these days. So,
any last minute questions from the audience? Yes, ma'am.
Good evening. Thank you guys for tonight. This past Memorial Day, I lost my sister to a fentanyl overdose.
I'm sorry.
Yeah, so I have a question. Are there any efforts in place to ensure that the arrested substance abuse users or disorder users, that they get any treatment? Are there any efforts for them to get treatment after they've been arrested?
There is. There's actually a Texas statute where now when somebody gets arrested for drugs and they go to around here, they go to the county jail. As soon as they say if they are addicted or they're using drugs, then they have to go through a little diversion to see a counselor and get, see if they need any kind of counseling or any kind of treatment that way. So those are in place, and we do it here at our local jail also. We have a questionnaire, and as soon as they answer yes to any of the addiction questions, we forward that on, with the paperwork to the county, and then they'll get diverted, to the mental health resources they need.
Thank you guys. Have a good night.
Can I add one more quick thing? Not for you, but just general, real quick. Fentanyl it's a prescription. It's a drug that is used in the medical field daily. If somebody's going to surgery, they get prescribed fentanyl. People at home, cancer patients or people that have really bad, illness or pain, they get prescribed fentanyl. So it's not all 100% bad. I mean, there are some people you talk to them and they're like, yeah, if I didn't have fentanyl, I probably wouldn't, make it through the day, because they're at home and they're just trying to make it day by day. The problem is that, people make it illegally and synthetic, it's a synthetic opiate and they make it in Mexico or make it in their garage and then sell it and put it in all the drugs. So it's out there. You're going to hear somebody says, I got prescribed fentanyl when I was in the hospital. And it's not like, oh my God, you're going to die. So I just wanted to put that out there, that it's a prescription drug.
I think, too, one comment that I thought of when you asked the question about your son's friends, and I know your son is older, but just in terms of a situation like that, I think really, even if you could do this with your son's friends now being older, but in general, I think if you do find out that your kid is messing around with drugs or experimenting, or God forbid, if your child ever were to experience an overdose, find his or her friend's parents and tell them, hey, my kid is suffering with this, and if your kid is hanging out with my kid, there's a chance that your kid is also messing around with this. Because I promise you, is that going to be uncomfortable? Absolutely. Is your kid and your kid's friend going to be mad or feel betrayed? Or absolutely. But you could save their life. And I promise you, all those things of discomfort and anger and frustration, none of that would compare to if that other child who you knew was hanging out with your kid and possibly using drugs, if something happens to them and they overdose or they die, you're going to wish you had had that conversation. You're going to wish you had picked up the phone and said, I know that my kid is doing this, and if you're hanging around with my kid, you probably need to talk to your kid. It's embarrassing maybe, or it's scary, or it's, like I said, uncomfortable, but none of that compares to the loss and the pain and all those horrible things that parents who have lost a child would tell you comes along with that. So I think as a parent, don't be afraid to have those conversations, right? Be willing to enter that space and make that phone call, because you would wish that it was reversed if it was your child.
This question's from the virtual audience. Has there been an overdose of any kind at Allen High School? And is Narcan on hand at the Allen High School?
There has not been an overdose at Allen High School. We've had kids experiment with drugs and get sick, ill, but ambulances have been called, but not to where they're fainting or there's risk of possibly dying. And the answer to the second question, yes, we all have 2 boxes of the Narcan to give if needed.
Any last questions from the audience? We'll take one more. Yes, ma'am.
Hi, I'm glad this is the last question because this is something that has not been mentioned. I have a comment and a question for my counselor friend over here. I haven't heard your voice yet again, so I wanted to ask you a question. To the parents, y'all, monitor what your children are watching. There is a show right now called Euphoria, and it is high school kids, and they are doing every drug imaginable. They are naked, they are partying, and they're high schoolers. But in the show, they're like 20, 30, whatever. It's very, 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 very popular. And it is glamorizing drugs, addiction, overdoses, and it's glamorizing depression. It's glamorizing mental illness. Some people claim that it's giving awareness. It's not. It's glamorizing it, and it's making it look beautiful. Have you heard of any sort of kids being influenced by the things that they're entertained by?
Well, I'm kind of glad you said something, because the biggest thing that I work with people that are 18 and up. So they're coming in and there's things going on in the home with the parents, with the grandparents. Maybe there's some mental illness, maybe there's substance use going on. So as parents, and we have to be the examples of our children. And if we're struggling ourselves and not going out getting help, then why wouldn't our children when they get of age? So, as far as TV shows and things like that, not really so much. Really coming from the home. It comes from the home. So I just wanted to close with, if you are struggling with mental illness, if you're struggling with depression as a parent, if you're struggling with addiction, go get help. Be that leader to your children. Be it.
One word we haven't mentioned, and I do want to mention, is trauma. And trauma is a big deal. It changes the way the brain works, and it needs to get treated. And so I would just encourage you, if your family's experienced trauma, death can be traumatic, loss can be traumatic. I treat kids who have witnessed other kids die. That's traumatic. And we need to get them help so that they don't feel a need to self-medicate. So I think it's really important that we look at trauma in our culture and we treat trauma in our culture scientifically and well.
This one on? Okay. I just want to say thank you to the panelists and to Allen Public Library. My name is Eric Ailes. I'm with Starlight Recovery Center, one of your hosts for tonight. And one of the questions, thank you, Nancy, for bringing that up, is what do you do when you have someone that needs treatment and needs help? And we have some resources on the back table with the Narcan, thanks to Stonegate, Kiera, and my colleague in the back, Erin. She'll be back in the back if you have any other questions about treatment options, different levels of care, things like that. Please let us know if you need help.
I'm going to close on this statement. I read a study one time how the children's issues started to mend and heal as the parents were healing. So we are our best friends to help in this addiction process.
Thank you for joining us tonight and joining us on social media, and we will see you next time.